Rebirth Certificate by Salim A. Salim by Texas Heart Institute Journal. Be close to your patient, but not too close. Those were the words of my professor of pediatrics when I was a medical student 11 years ago. They meant little to me at the time. A decade later, however, after developing my own clinical experience, I understood the wisdom of his advice. Recently, I found myself deeply involved, perhaps too much so, in the care of one of my patients, Mr. D. I was a faculty member in internal medicine at the university hospital where Mr. D had been admitted for fever and fatigue. Of 1 month's duration, preliminary studies showed low platelet and high white blood cell counts. Subsequent bone marrow examination confirmed the diagnosis of acute myeloblastic leukemia, and he was transferred to the oncology ward. It was there that he and I first met one another. I introduced myself by name and title and mentioned that I would be his physician. He in turn replied anxiously, "I am Mr. D, a new cancer patient." We shook hands and spent about 15 minutes getting to know each other. I left his room, unaware that this new relationship would soon cause me enormous emotional distress and spiritual disturbance. Mr. D's treatment was long and exhaustive. Many cycles of chemotherapy, transfusions of blood and blood products, frequent monitoring of blood counts, and many lumbar punctures. In addition, numerous therapeutic side effects and sequelae presented further challenges for him and for me. Despite these obstacles, Mr. D's leukemia went into remission and he was discharged from hospital, a happy man. During that ordeal, I got to know Mr. D in detail. In fact, I knew more about him than did any of his closest friends. His hobbies, interests, how he met his wife, his movie favorite, etc. I thought about and cared for him more than I did for any of my other patients. And during his remission, I called him or he called me daily. We had more than a solid patient-doctor relationship. We had forged a special and sincere friendship. Regrettably, the remission was short-lived. 8 days after his discharge, he returned to the emergency department not feeling well. Within hours, he developed high fever and multi-organ failure, which prompted his transfer to the intensive care unit. Nearly every one of his laboratory studies was strikingly abnormal, including no detectable circulating white blood cells. One fact seemed clear: impending death. Why this sudden turn of events, I wondered. Why was I somehow at fault? Why is life so unfair? What did Mr. D do to deserve this? Many questions ruminated. All I could think about was Mr. D and death. I lost track of my other patients and was so disturbed that I could not carry out my routine daily work effectively or get any sort of sleep at night. I stopped enjoying my own life and became very depressed. I now realized that I had allowed myself to become too attached to Mr. D, and because God presumably had not heard my prayers. I was mentally ready to attend Mr. D's funeral. Fortunately, I was wrong.